All right, so hello everyone. Hello everyone. Hello everyone. My warm greetings to everyone. Am I audible? Yes, everyone. Mic check, mic check. Am I audible? Yes, everyone. Am I audible? All right, so hello everyone. Am I audible? So, how is audio visual? Please write in the chat box. How is the audio visual? First, please write in the chat box. Am I audible? My hello to everyone. Hello everyone. Yes, yes. You will be able to share meme in the telegram group. You will be able to share the meme. So if the audio visual is clear, let us quickly start the session without wasting the time. Let us quickly start this session without wasting the time, right? I know many of you are not night owls, right? You are awake for the session. I understand. Let us quickly start. So guys, this session is about so this session is about this session is about I have divided this session in three I have divided this session in three sub sessions. In one, I'm going to discuss all the wrong question. In first session, I'm going to discuss all the wrong questions which were marked wrong in the quizzes. Next is about a quick recap of all the formulas and images. A quick recap of all the formulas and images. And last is rapid fire. And the last is rapid fire. So without wasting time, let us quickly start. Coming to the first session, the wrong questions analysis. Now first is, what is the high prevalence of disease indicator? Before I go in detail of this topic, I just want to tell you that prevalence is equal to incidence multiplied by duration. So prevalence is incidence multiplied by duration. The prevalence is only going to be affected by two things: incidence and duration. Incidence and duration. Duration of the disease can be affected. So duration of the disease, guys, how the duration of the disease can be affected? Any guess? Please write in the chat box. Duration can be affected either recovery or it is affected by death. Suppose we have a deadly disease. Within 2-3 days the patient will die, like in case of rabies. So there will be less duration, which will lead to less prevalence. And if there is a quick recovery, a fast recovery, duration will be decreased. Suppose a disease is going to take 10 days to recover, but you have given a medicine that will take only 2 days, right? So here again, decrease, right? So high prevalence of disease, the long duration, this is correct. But I want to tell you, A is also correct. A is also correct. Right? Both A and C are correct. But the best answer, if the same question comes, then obviously the answer is C. Now guys, one thing I want to tell you, and this thing is a recent INSET question. And the thing is, if we have a drug which prolongs life but does not cure, what will happen to the prevalence? Guys, quickly in the chat box. Yes, guys, quickly in the chat box. We are going to do the session very quickly, right? Yes, this was the recent INSET question. A drug which is prolonging life but does not curing, right? What will happen? Yes, guys, what will happen? There will be increased prevalence. right? Now, coming to next question, which factor does not influence incidence? Which factor does not influence incidence, right? So incidence can be increased by age distribution. Like some of the diseases, they are common in younger age group. Some of the diseases, they are common in elder age group, right? But some of the diseases, they are common in elder age group, right? But the thing is, gender also affects. Like breast cancer is more common in a particular gender, right? Duration of illness is the correct answer. Duration of illness is the correct answer. Now, coming to the next question, a researcher is studying a group of patients diagnosed with rare neurological disorder. The researcher collected detailed clinical information of 20 patients, right? So keywords, let us catch the keywords. Who presented with similar symptoms? Which of the following study design best describes? So guys, rare, right? Rare. Rare clinical features. If you are talking about one case, it is a case report. If you are talking about group, then it becomes case series. Then it becomes case series. That is why the answer here was option C. That is why the answer here was option C. Now, coming to the next question. A researcher is studying a group of patients diagnosed with, okay, I think this is the same question. Now, next question. A researcher is investigating a relationship between lung cancer and cigarette sales. The researcher collects annual cigarette sale and lung cancer mortality from various countries. So guys, what is the keyword? Yes, what is the keyword here? The study is done in population of different countries, right? Population of different countries. And that is why the answer here is ecological. That is why the answer here is ecological. Now, my next question to you is, what is ecological study also known as? What is ecological study also known as? It is also known as correlational study. It is also known as correlational study. And what is the unit of study here? The unit is population. What is the unit of study? Unit is population. Unit is population. Sorted? Can I go ahead? Yes, everyone. Can I go ahead? Guys, I think there is a lag between when I am speaking and when it is streaming to you, right? When it is streaming to you, there is a bit lag, right? All right. Can I go ahead? Yes, everyone. Is this sorted? Can I go ahead? Now, coming to next one, a study is conducted to investigate association between pesticide exposure. So the study is done. Pesticide exposure and development of Parkinson's disease. Development of Parkinson's disease. Researcher identified 100 individuals diagnosed with Parkinson's disease and 100 without from a local hospital. They then interviewed, and which study design best describes the study? What they are doing here, they have two groups, one with Parkinson's disease and another group with Parkinson's disease absent. And what they are doing, they are assessing the history of exposure. So what they are doing about pesticide exposure, right? So this study is a case control study. So this is a case control study, right? This is a case control study. So what is the keyword here in case control study? What is the keyword in case control study? The keyword is history of exposure. History of exposure, right? History of exposure among diseased and non-diseased. So this is the keyword, do not forget it, right? This is the keyword, do not forget it. Now coming to the next question, a study aims to examine prevalence. So what they are trying to do is they want to study prevalence of hypertension. Which study design is most suitable? Guys, for prevalence we do cross-sectional study. Very good, beta. Very good. Very good. We do cross-sectional study, right? So here the correct answer is cross-sectional study. Now the next question, which of the following is not advantage of cohort? Which of the following is not advantage of cohort? Guys, we get incidence from cohort. That is true. We can establish temporality, or you can say temporal association. This is also true. The question is not an advantage. Not an advantage. Right? Now, it is less prone to recall bias. That is also true. But this is suitable for studying rare exposure. Right? So this is the advantage. This is the advantage. Right? Now, so a research study aims to investigate long-term effects of specific medication on development of cardiovascular disease. The researcher identifies a group of individuals who were prescribed the medication, right? Who were prescribed medication of interest 5 years ago, and another group of individuals who were not prescribed. So what the researcher is doing here, 5 years ago exposure, right, from records, right? And now let us see what they are saying. Then they review both the groups to determine the incidence. So the keyword here is incidence. So guys, what is happening here? So basically in this study, the researcher is, suppose the researcher is in 2024. So the researcher is taking the history of exposure from 2019. On the basis of the 2019, whether they were given the medication or not. And today the researcher is examining whether they developed the disease or not. So guys, here the correct answer is retrospective cohort. Why retrospective cohort? There are two reasons for retrospective cohort. Number one is incidence, right? Incidence is between incidence, we get incidence from cohort study. So option A I want to rule out. And second is the second which I want to tell you is the second is record of exposure. The second keyword is record of exposure, right? The second keyword is record of exposure. That is why the correct answer here is retrospective cohort study. Retrospective cohort study, right? Now one student is asking, Shiv Kumar is asking, sir, why not option C? Why not option C? So why, when you want to answer, when I'll say the answer is option C today, so the question language will be the researcher is including a group which is taking the medication, right? And then they are followed for 5 years. If this is happening, then it is a prospective study. If this is happening, then it is a prospective study. Is that fine? Yes, is that fine? Now, a researcher is interested in studying the incidence of heart disease among individuals who consume Mediterranean diet compared to those who do not, right? So what is happening here? We are doing incidence among two groups, taking Mediterranean diet and not taking Mediterranean diet. Yes, exactly, right? So here we have two groups. In this study, we have the history from records. That is why here the correct answer is retrospective, and here the correct answer is cohort, or you can say prospective cohort. Right? If the option is prospective cohort, retrospective cohort, then the best answer is prospective cohort. Now, which study design is best suited for investigating efficacy of new vaccine? So here, new vaccine, right? So guys, what is happening here? Here we are doing a intervention. Here we are doing intervention. We are giving a vaccine, right? Here we are giving a vaccine. So what is happening here? We have a new vaccine and we want to assess this new vaccine intervention. So whenever the intervention is there, the correct answer here is RCT, right? Whenever the intervention is there, intervention means, yes guys, intervention means experimental. Intervention means experimental, right? Intervention means experimental. Now, in a cohort study, if the risk is 0.2 and the incidence, guys, point number one I want to tell you in this question, risk, if somewhere incidence is not mentioned, see, in this question I have mentioned incidence in bracket. So risk is equal to incidence. They might not write incidence, because if I talk about the USMLE pattern questions, if I talk about USMLE pattern questions, in USMLE pattern questions at many places they do not write about incidence, they write about risk. A similar question came 3 to 4 years back where they said that risk is given and what is the I mean to say relative risk, right? So risk means incidence. If they have not mentioned, if they have not mentioned, if they have not mentioned incidence, only risk is there, then it means incidence. Okay. Yes, Shiv Kumar, if only cohort is given, that it is implied most of the times they mean prospective. Swati, sir, please explain washout period. In the upcoming week, I'm going to talk about RCT, meta-analysis, bias. There I'll talk about the washout period. Right. So here they have given incidence among exposed 0.2, incidence among non-exposed 0.1. You have to find attributable risk. You have to find attributable risk, right? So guys, there is a controversy regarding attributable risk which I will talk about in the formula section. In the formula section I will talk about this, right? So here the attributable risk formula is exposed minus non-exposed divided by incidence among exposed multiplied by 100. I'll talk why the controversy is there. I'll talk in the next section, right? Now this was the question where the relative risk is given 1.5. The relative risk is given 1.5. So now they are asking about what is 1.5 relative risk means. Guys, 1.5 relative risk means the risk of developing the disease in exposed is 1.5 times higher in exposed as compared to non-exposed, so this was the questions which were there in which were there in our quizzes, right? Now coming to the section 2. In the section 2 we have the formulas. In the upcoming quiz, आगे भी जो भी quiz होंगी, section 2 is for only formula and images, right? Now, yes, now you have to tell me about all the formulas, right? You have to tell me about all the formulas. Yes, guys, quickly in the chat box, what is the formula for odds ratio? Guys, what is the formula for odds ratio? Quickly. Can I say it is AD by BC? Yes, formula for odds ratio, AD by BC, right? All right. So guys, are you there? Yes, are you there? Can I get few thumbs up, few smileys in the chat box if you guys are there and if you guys are awake? Yes, can I know you guys are awake? Can I get few smileys in the chat box? है ना? थोड़ी सी स्माइली बरसा दो, है ना? In the chat box, are you there? Awake? Yes, are you awake? All right. Odds ratio we get from case control. We get odds ratio from case control. Now, what about relative risk? Relative risk is incidence among exposed divided by incidence among non-exposed. Incidence among exposed divided by incidence among non-exposed. Now, attributable risk. Now coming to the controversy. Guys, when I take USMLE batch, I teach attributable risk is incidence exposed minus incidence non-exposed. And I tell them that attributable risk proportion is incidence exposed minus incidence non-exposed divided by incidence among exposed multiplied by 100. This is what is given in international books. But from many years in Indian books and in Indian entrance exams, they are following incidence among exposed minus incidence among non-exposed divided by incidence among exposed into 100. Specifically in NEET-PG and FMG exam, right? Specifically. But in my every USMLE batch from last 5 to 6 years, I am teaching this, right? But in Indian books and in the previous year questions, right? This is what they have mentioned. This is what they have mentioned, right? Now the question comes, sir, what to mark in exam? If they have asked attributable risk and they have given percentage in the option, right? That means you have to follow this formula. That is the controversy. In my every face-to-face batches, I have cleared this doubt, as well as in my B2B lectures, I have cleared why the controversy is arising and what is the reason and what we should follow. Dr. Vaishnavi, in the next slide, in the upcoming slide, I'll talk about risk difference. This section is only about formulas, and if images are applicable, then I'll put the images in this section. But because the chapter is epidemiology, we have to only mug up the formulas here, right? Now coming to PAR. Now coming to PAR. Is that right? Yes, Dr. Vaishnavi, Dr. Asmita, in the next section I'm going to take it. Now PAR is incidence total minus incidence non-exposed divided by incidence total multiplied by 100. This is population attributable risk. Now coming to number needed to treat and number needed to harm. Guys, number needed to harm is equal to 1. Okay, number needed to treat is equal to 1 divided by incidence among non-exposed minus incidence among exposed. This number needed to treat is calculated when exposure is protective. Number needed to harm is calculated when exposure is harmful. Right? Now, what is number needed to harm? 1 divided by incidence among exposed minus incidence among non-exposed. Guys, in many of the resources, you will find that number needed to treat is given something else, and that something else is 1 divided by CER minus EER. What is CER? Control event rate. Who is a control? The non-exposed or the placebo. It is the same thing. CER is non-exposed. Experimental event rate, experimental group, where we give the interventional drug, that is incidence among exposed. So this is a quick revision of all the formulas, right? Now coming the final, the rapid fire round. Are you ready? Are you ready? Guys, are you ready? The rapid fire, in this rapid fire, right? In this rapid fire, I want the chat in this rapid fire. In this rapid fire, I want the chat box full because I want everyone, I want all of you to answer. Are you ready? Can I go ahead? Yes, everyone. Can I go ahead? Are you ready? All right. Let's go then. Unit of study in ecological study. Yes, guys, quickly. Unit of study in ecological study. Population. Incidence is estimated by, yes, guys, cohort study. Cohort study. Prevalence is estimated by cross-sectional. Natural history of disease. Natural history of disease. Cohort. Very good, beta. Very good. I'm happy to see all this chat. I'm happy to see all the chat, right? Now, temporality. Temporality or temporal association, guys. Quickly. Cohort. Cohort. Study which goes from effect to cause. Effect to cause. Study which goes from effect to cause. This is recent FMG question. Effect to cause. Case control. Effect to cause, beta. Case control. Strength of association for case control, guys, quickly. Odds ratio. Strength of association for cohort. Relative risk, attributable risk, and population attributable risk. Recall bias is seen in, guys, quickly, case control. Recall bias is seen in case control. All right. Now, best study to evaluate intervention and outcome. Okay, I am taking a pause because I know there is a lag. थोड़ी देर का lag है when the video is streaming. Best study to evaluate intervention and outcome. Guys, this one. Best study to evaluate intervention and outcome. RCT. Very good. Intervention and outcome is RCT. Best study to evaluate exposure and outcome. Cohort. Cohort. Best study to evaluate rare disease. Rare disease, guys. Rare disease. Case control. Best low cost study to evaluate exposure and outcome. Guys, any guess? Again, case control. Risk ratio is known as relative risk. Risk difference is known as attributable risk. Difference between incidence in exposed and non-exposed. Guys, again, attributable risk. Attributable risk. Right? Okay. We are done with the session. We are done with the session. I hope you guys enjoyed the session. I hope. And I can see the energy in the chat box. I can see the energy in the chat box. Right? So we are done with the week 1 schedule. And now from tomorrow, week 2, I'll share week 2. The plan is to cover the epidemiology, RCT, bias. RCT bias is pending. I will give you a new schedule. You will be getting a new schedule. Quiz timing change, guys. from tomorrow I'm going to change the quiz time. I know majority of you wanted around 10, but it is becoming difficult for me to manage at 10 because the quiz goes till late. PSM sorted hai bhai, PSM sorted hai. I'll try my best, right? Okay, I'll try to give you the whole month schedule. I'll try, but for this month I will definitely give, right? And number of questions, many students gave the feedback the 5 questions are less, we need to practice more. So number of questions from tomorrow, 10 questions, that's a promise. And also I'm going to change the pattern of quiz, because in this pattern what I have did is I gave you questions and you have to attempt. We are going back to what we started, right? We are going back to what we started. It is going to be a live quiz where 45 seconds for each questions, right? And I don't know how to handle this. That is the biggest villain, right? Thank you bhai, thank you so much, thank you so much Asmita, thank you bache, thank you so much, right? Keep giving the quizzes, thank you Asmita, thank you Harshit, thank you bache. Neat INSIT, thank you बच्चे, वेलिश, yes, right? So ये टेंशन है बच्चे. बाकी I'll try to give you live quiz. This is what majority of the students told me, right? चलो everyone, boat, yes, boat is the issue. This pattern is also good. Yeah, this pattern is also good. But everything comes with two sides. Everything has two sides. Profit, loss. Benefit, less benefit. I understand this pattern is having own benefits and the previous pattern is having own benefits. But I like the fact that we want to prepare you guys, and I want to give you 45 seconds to attempt a question. This is what we want. That is what we want, right? So okay, Velish, I'll try, बच्चे, I'll try. I will definitely try. I will try. Okay, ऐसा करेंगे, एक live quiz रख लेंगे, and after live quiz, those who missed, I'll give the link and questions will be shared in the channel. Is that fine? Thank you, Rohan. Thank you so much, बच्चे. Okay, बच्चे, DRS. Okay. Yes, yes, Dr. Swati. Thank you so much. Thank you, the good doctor, बच्चे. Thank you so much. Okay, Dr. Velish, definitely will do that. All right. Good night, everyone. Good night, everyone. Right? So we have other 18 subjects also, right? Other 18 subjects also, right? So it's a humble request. Give your regular GTs. It's a humble request. Sumer sir and Deepti ma'am, they are coming live on the eMedicos app, right? You have the transform series. जब भी डाउन हो, जब भी आपको ऐसा लग रहा है, you are feeling low, तो आप वो देख सकते हैं, right? All right. So good night, everyone. Once again, if you have any doubt, you may ask in the group. And yes, do not forget to subscribe, right? No, do not forget to subscribe.